Welcome back, all the viewers. This video is very useful for all the patients and dear students. Today we are going to discuss a crucial topic, the differences between oral cancer and oral ulcers. So all the patients and the students should know that what are the major key differences between the oral cancers and oral ulcers. What happens many of the times in our clinics, many patient comes and they are late for diagnosis of the oral cancer. They think that this is oral cancer, oral ulcer, but after wasting a lot of days, the dentist or the practitioners, when the patient visits to their clinic and they see intraorally in their mouth, and they detect that that is not oral cancer, that oral ulcer has been converted into the oral cancer. So how we should have a basic idea the what is difference between oral cancer and oral ulcer. Okay, so today we are going to discuss a crucial topic, the differences between oral cancer and oral ulcers, and what are the key differences, what are the indications, contraindications of this. It's important to know the signs and symptoms of each, as early detection can save lives. Let's dive in. First, let's define what we are talking about. First, we will see oral ulcers in detail, also known as chancre sores, are painful sores that appear inside the mouth. They can be caused by stress, infections, or nutritional deficiencies. On the other hand, oral cancer refers to the uncontrolled growth of abnormal cells in the mouth, which can be life threatening if not treated early. Let's start with the oral ulcers. These are typically small round or oval sores with a red border and a white or yellow center. They usually appear on the soft tissues of the mouth, like the inner cheeks, lips, and tongue. So we should regularly check these areas, that is inner cheek and lips and tongue. Now let's talk about oral cancer. It can be it can manifest as a persistent sores, lumps, or patches in the mouth. Unlike oral ulcers, these lesions do not heal on their own and can spread to other parts of the body if not treated. So we should know features of oral ulcers and oral cancer. Example, what are the causes of oral ulcers? Trauma, stress, infections, nutrition deficiencies. Example, the main cause of oral ulcer is the trauma caused by the sharp teeth. So the patient should visit to the dentist, and the sharp teeth should be rounded well, and the trauma should be relieved for the patient. The main cause of oral cancer is tobacco, alcohol, the various systemic diseases, chronic irritation, and genetics of the patient. There are different key features. Now we will see that oral cancer is uncontrollable growth of cells that invade and cause damage to the soft tissue. So these are the soft tissues. That is the lips, inner border of the tongue, the lower surface of the tongue, the cheeks, and the palatal surface. So we have to check that is there any growth, uncontrolled growth. So if there is uncontrolled growth, it may be signs of the oral cancers. So they can occur anywhere in the oral cavity. What are the causes of oral cancers? The causes of oral cancers are smokeless and smoking tobacco use, area, nut chewing, different habits are there like nut chewing, alcohol, poor nutrition, HPV viruses, then genetic factors and chronic trauma. The chronic trauma can be caused by the sharp teeth. So these sharp teeth should be rounded off or can be covered with the help of the crowns. The main cause we have to reduce so that there should not be the oral cancer in that area. That is called as the traumatic ulcer. Now, what are the different risk factors for the oral cancer? Now we will see the risk factors. These are the different risk factors for the oral cancer, like chewing or smoking tobacco, drinking excess alcohol, exposure to the sunlight for long periods of time, exposure to certain chemicals, sulfuric acid, and different substances which are there in the different habits like tobacco and alcohols. Human papilloma virus, it is commonly called as HPV infection. Weakened immunity due to certain medications. So if your immunity of the body is reduced, that time also due to certain medications it can cause oral cancers. Consumption of diet rich in the processed meat and fried foods. It may be spicy food or hot food. skin disease like lichen planus. So lichen planus should be treated with the help of the medicines. So you should visit dentist to cure the lichen planus, or or else it will be converted into the cancerous lesion. Certain inherited conditions of the blood. What are the symptoms of oral cancers? Now we will see what are the signs and symptoms of the oral cancers. White or red patches on the lips, on the gums, tongue, buccal mucosa. If we observe white or red patches on the lips, gums, and tongue or buccal mucosa, it should be seen properly and cure should be done. So, first point we have to check ulcers which do not heal within 3 weeks. So, if there is ulcer more than 3 weeks, you should immediately seek attention to your dentist and it should be treated well. Second, red and white patches in your mouth. Third, lumps, unusual lumps or swellings in your mouth. Pain or difficulty in chewing, swallowing, or speaking. Then change in the voice of the patient. Then loosening of the teeth without significant reason. So this should be treated well. These are the few pictures where we can see that presence of lump in the buccal mucosa. We can see that the presence of the lump in the buccal mucosa. So this may be the signs of the oral cancer. Second is burning sensation on the tongue. So if there is burning sensation on the tongue, this may be also sign of the cancer. Then third, we can say ulceration in the lower border or the floor of the mouth. This is the ulceration area in the lower border or floor of the mouth. This may be due to the sharp teeth. So this sharp teeth should be relieved properly, or it should be covered with the help of the splint. Then we have to properly examine the lower border or dorsum of the tongue properly. The numbness or pain in area of the mouth that do not subside. So if there is numbness or loss of taste sensation for more than 3 weeks, you should seek proper attention. Bleeding in the mouth, a lump which can be felt inside the mouth on the neck. So due to the different lymphatic drainage, a lump can be seen in the neck area. So we have to take proper attention for this. Jaw pain or stiffness, sore throat, difficulty wearing dentures. If patient is without any teeth and has difficulty in wearing the denture, so it should be checked properly so that there should be no delayed symptoms for the patients. A sore on the lips or in the mouth that does not heal more than 3 weeks. Coming to the diagnosis of oral cancer, persistent changes such as mouth or tongue ulcer for those weeks or more is not normal. So if there is ulcer in the tongue and the ulcer is for 21 days, you are regularly taking different ulcers and different multivitamins, medications, but that ulcer is not healing. So this may be the early sign of the oral cancer. Clinical examination. Oral cavity is easily accessible for examination. The dentist may be the first person to spot signs of the mouth cancer. A thorough physical examination of oral cavity is the most essential and basic procedure that provides valuable insights into a person's overall state of the health. If there is signs of the oral cancer, if your dentist examines your oral cavity and informs patient that this may be the oral cancer, so first action should be taken is biopsy. So biopsy, what is biopsy? We have to take small part of that area or incision in that area, and we have to send that part to the laboratory for further investigations. If a suspicious area is found in patient's mouth, your doctor or dentist may remove a small piece of tissue for laboratory testing, that is called as biopsy. So in this image we can see that if there is epithelial lining is here, or in this area if we can see that there is a signs of oral cancer, so this part can be taken for biopsy. So there are different types of biopsy that we will not go in detail, only in this presentation only we will cover the basic part. The doctor might use a scalpel to cut away a sample of tissue, that is called an excisional biopsy, or use a needle to remove the sample, that is called as FNAC, that is fine needle aspiration cytology. That means in this, with the help of the needle, we withdraw fluid from that area, and further investigations can be done by checking the color of the fluid and the laboratory testings. In the laboratory, the cells are analyzed for cancerous or precancerous lesions, changes that indicate a risk of cancer. A biopsy may be carried out where a small sample of tissue is taken or checked for the cancerous cells. sometimes a brush biopsy. So with the help of the brush, we can take the tissues or abrade a tissue in that area, and we can send this biopsy to the laboratory for further investigations. These cells are painlessly collected by brushing them to one side. So this may be for the initial stages, but incisional biopsy is the proper test. Then second examination is endoscopy. With the help of the endoscope, that is endoscopy where a lighted scope is passed through the patient's throat to see how far the cancer has spread. So with the help of the endoscope, the lighted camera or a part of the endoscope is passed through the oral cavity through the throat to check the what is the spread of the cancer. It is more or it is less, that we have to take proper care. Then what are the different imaging techniques? These are the further investigations after we get positive biopsy test. Then we have to go for the different imaging techniques like X-ray, computed tomography, CT scans. Nowadays CBCTs are available, and magnetic resonance imaging, that is MRI. PET scan can be done for the further investigation to check the spread of the cancer. Help in the staging of the cancer. So at this stage we can stage the cancer, that is stage 1, stage 2, stage 3, which will inform treatment options and help predict different prognosis. Then what is the treatment of oral cancers? Treatment depends on the location and stage of the oral cancer. So where the cancer has been detected, in the patient's mouth, in the floor of the mouth, on the tongue or buccal mucosa. So depending on the location and stage of the cancer, that is stage 1, stage 2, stage 3, or grade 1, grade 2, grade 3. According to the different stages and grading, different treatment options are given to the patients. And the patient general health and personal preferences. So health also we have to take into account. If patient is elder, so the prognosis of that patient will be poor. So we have to check proper age of the patient before going for the surgery of the patient, and what are the preferences of the patient, whether he has to go for surgery, his family members and patient will decide what he has to go for. Okay, so all these points should be taken during treatment of the oral cancer. Coming to surgery, after the patient decides that surgery has to be done for the area involved, so it involves resection, that is removal of the part of that tumor and a margin of a healthy tissue around it. So during surgery we have to resect all the part, all the tumor and the adjoining tissues properly, and we have to remove all the margins to have proper healthy tissue around it. Small tumor will require minor surgery, but large tumors require surgery may involve removing some of the tongue or the jawbone. And proper follow-up should be taken by patient to have further less complications. If the cancer has spread to the lymph nodes in the neck, the cancerous lymph nodes and related tissue in the neck will be surgically removed. So we have to remove lymph nodes also, because they may again spread cancer in that area or the adjoining tissues. What is reconstruction? After surgery has been done, after total healing, after 6 months or 1 year or 3 months, we have to go for reconstruction of that area with the help of the prosthesis. So reconstruction may be required for major surgery cases. This involves using a transplanted grafts of the skin, muscle or bone from other parts of body. Dental implants may be needed. If the available bone is proper, we can go for dental implants, which is widely accepted by different patients and they have good results. Now coming to radiation therapy. If your cancer is benign or malignant, after surgery we have to go for radiation therapy so that there should be no reoccurrence of the cancer. So it may be used alone or in combination with chemotherapy or surgery depending on the laboratory investigations. It involves beams of the high energy X-ray or radiation particles to damage the DNA inside the tumor. So the DNA of the tumor cells should be damaged properly, so destroying their ability to reproduce the cancer cells again. Mask to keep the head still during radiotherapy. During radiotherapy, we have to take proper precautions that those radiations should only focus on the infected area, not on the normal tissues, because they will again damage the normal tissue. So there are different shields available for the patient so that it should avoid the spread of the radiations on the normal tissues. External beam radiation delivers radiation from outside, while in brachytherapy, radioactive sheets and wires can be placed near the cancer inside the body. It is useful for the patients in the early stages of the oral cancers. So they are mainly useful for the early stages of oral cancers. Radiotherapy combined with the other treatment options may also increase the adverse effects. So these precautions should be taken. What are the adverse effects of the radiation therapy in the mouth? These are the following adverse effects. A dentist can also help you understand how best to care for your teeth during and after radiation therapy to reduce your risk of complications. So, different salivary substitute tubes can be used to avoid the further radiation effects. So, teeth decay, skin reaction burns, mouth sores, bleeding gums, fatigue, and jaw stiffness, it should be properly. Coming to chemotherapy. So, after radiation or in combination with radiotherapy, chemotherapy involves using medications that damage the DNA of the cancer cells. So, again, these chemotherapy drugs will damage the DNA of the cancer cells, preventing them from replicating but the expense of the healthy tissue. The following adverse effects may occur: fatigue, nausea and vomiting, hair loss, weakened immune system, increasing the risk of the infection. Although these effects usually subsides after finishing the treatment. So after your chemotherapy and radiotherapy and after few days, when patient's immunity is gained properly, the adverse effects usually subsides. So there is no need to worry, but we have to go for the chemotherapy in few patients. Targeted drug therapy. This is one more therapy. It uses drugs known as monoclonal antibodies to change aspects of cancer cells that help them grow and may be combined with the radiotherapy or chemotherapy. For example, these are the few drugs which can be given in patients. These drugs are not available in our area, but we can go for the other drugs which can be used with the chemotherapy and radiotherapy. The following mild adverse effects are as possible: nausea, vomiting, breathlessness, diarrhea, conjunctivitis, allergy to certain drugs, laxity, eczema. How to cope psychologically with the oral cancer. So this is the main slide. How patient or relatives can cope with the psychology with the oral cancer. It is rightfully said that cancer affects not only a person but his entire family. Many people feel depressed and stressed while dealing with cancer. To help yourself stay healthier, try to speak with the counselor or your healthcare team professional. Take time for yourself. Go for spiritual advisory. You can option for medications for depression or anxiety. So the main role of family members is crucial for these patients. So family members should behave as it is normal thing for the patient, because if the surrounding is positive for the patient, the psychology of the patient will be good and the healing of the patient will be faster, and after healing the patient can go for the normal life. Be social and physically active. Eat a healthy diet with as many as healthier foods. Drink plenty of water, fruit juices, and other liquids. Rest as much as needed. Talk with your healthcare team about ways to manage treatment side effects. Take your medications as directed by your team. Oral cancer prevention tips. So, what are the things we can take precautions of to avoid these oral cancers? Always brush and floss your teeth regularly. Regular patient checkup and follow-up visits should be done to the family dentist. Do not smoke or chew any type of tobacco product. Drink alcohol in moderation. Avoid necessary. So alcohol should be stopped. Limit your exposure to the sun. Choose cancer fighting diet. See your dentist regularly and exercise regularly. So these are the few slides. This is the summary for how to avoid the cancer in different conditions. So oral cancers and oral ulcers typically heal within 1 to 2 weeks and can be managed with the help of the typical treatments, mouthwashes and avoiding irritants. But oral cancer should be taken special care. So early detection is the key for oral cancer. So remember, knowledge is power. By understanding the difference between oral cancer and oral ulcers, you can take proactive steps to avoid this cancerous lesion and to protect your health. Stay focused and stay regularly updated with your dentist and dental follow-ups. Thank you.